and relax. Perfect. Now, close your eyes gently, not squeezing them, just nice and slowly. Hi. Before we get into this video, I'd like to thank all my Patreon members for their continued support. If you're looking to follow me on other platforms that I create on, my link is in the description below. Now, let's get into the video. Good morning. It's 9 o'clock, right on time. Welcome back. I'm glad you were able to return this morning so we can finish the second half of your assessment. Before we continue, I just want to check in with you. How did your eyes feel after yesterday's testing? Any lingering strain, headache, blurred vision, dizziness, or sensitivity to light? All right. That's helpful. Did anything change overnight? Any new symptoms at all? Perfect. That's exactly what I wanted to confirm. Yesterday we completed the detailed eye inspection, the pupil responses, the eye tracking, convergence, and most of the movement testing, and everything we saw was reassuring. However, today we'll finish your peripheral vision, and we will add a few visual processing exercises, a brief facial neurological screening, and some simple memory and coordination tasks. Then I'll give you a concise summary of that complete examination. We'll keep this appointment, however, much shorter. You've already done most of the demanding portion of the exam itself, so just settle in, relax your shoulders, and look directly at me. Perfect. So, I'm going to raise both my hands near the outer edges of your vision. We'll begin with your peripheral vision. I'd like for you to keep your eyes fixed on the bridge of my nose. Try not to look directly at my fingers, just the bridge of my nose. You'll notice them moving, but your eyes should remain right here. Excellent. I'm going to begin on your right side. Tell me now the first you notice movement. Ready? That was a tester. Here we go. Keep looking at me. Good. That was nice and steady. And now? Good. Perfect. Any issues with that? Good. That was exactly where I expected you to notice it, on that corner as it enters your line of sight. Let's repeat it once for consistency. Keep your eyes centered on my nose. Ready? And now? Excellent. Very similar response to the last one. Now, excuse me, we'll get to the other side. Same sequence as before. Stay focused right here on my nose. Tell me when you see it. Good. Perfect. Let's repeat that side once more, shall we? Tell me when you're ready. Here we go. Good. Excellent. Both sides are giving me a very balanced responses, which is exactly what I'm looking for. Now I'm going to check the upper portions of your visual field. So keep looking at my nose. I'm going to move a hand downward from your line of sight to your line of sight. Are you ready? Tell me when you see it. Good. We're going to repeat that again from your left side. Tell me when you see it. Excellent. Now we'll check from below, coming from your chest up to your eyes. Ready? Good. Great. Perfect. We'll do it again, but we're going to do it from your right side. You tell me when you can see it, okay? All right, just let me know when. Good, very good. I do apologize. I just had breakfast, so I'm quite full at the moment. Your upper and lower visual fields appear evenly responsive. I'm not seeing any meaningful delay on either side, so now I'll move both hands at different times. You tell me which side moves first. So, keep your eyes centered on my nose again. You tell me which side you see first. Good. That's correct. The right side of your field came in before the left. All right, here we go again. Again, that right side. I'm seeing if you're able to use your eyes and judge when something shows up on a given side. One more time. Ready? Good. Now we'll do one more. Did they appear together when I did that? Perfect. That's excellent. That completes the peripheral vision portion of the exam. Your responses were prompt and they were very consistent. So go ahead and blink again for me for a few times and let your eyes reset. Excellent. So now we'll be moving into visual processing. I'm going to show you a few simple hand signals and just answer naturally. There's no need to respond quickly. All right? Good. All right, so how many fingers do you see? Perfect. And now? Excellent. All right, I'm going to do something now. Ready? And how many fingers? Good. I'm going to change the distance on you again. That one was closer. So here we go. Let me know how many fingers you see. And how many did you see? Excellent. So what I'm going to do is I'm going to bring my hand closer, and I'd like for you to tell me again how many fingers you see. Good. Still 3. So the distance is not affecting your recognition. So what I'd like you to do is I'd like you to now keep looking at my hand, and I'd like you to tell me which finger moves, all right? So of these whole fingers, which finger is moving? Which finger was that? The index, that's correct. All right, and ready, and which finger is moving? The majority of which finger was moving? That's right, my middle finger. Perfect. And now? Excellent. Your visual recognition is immediate and accurate. So now I'd like to check your color recognition. I don't have many objects on me, so I'm going to point to a color, and I'd like you to just tell me what color it is. What color is this? Perfect. And what color is my shirt? That's great. And what color is my pen? Yes, again, it is blue as well. Excellent. Now, I'm going to hold up 2 colors together at the same time. Which one appears brighter to you? Ready? Good. There isn't necessarily one universal answer. It's just I'm checking whether you can compare the 2 colors comfortably. Let's try one more pair. Ready? Which one seems brighter? Perfect. That looked very easy for you. Now, I'm going to hold up a small object. I'd like you to keep your attention on the tip of it, all right? Where did I put that? There we are. I'd like you to focus on the tip of that pen, just the little tip piece. Tell me if it becomes slightly blurred as I move it closer. Keep watching. Still clear? Good. And how about now? And now? All right, I'll move it back. Tell me when it becomes sharp again. And now? Perfect. That's exactly what I wanted to see. Your response was completely appropriate for what I needed to see. Your eyes adjusted smoothly as the distance changed. Go ahead and blink for me. Great. So now we'll shift away from your vision and briefly check the muscles on your face. So I'd like for you to just sit naturally. Relax your forehead and jaw for me. Let them, perfect. First, I'd like you to raise your eyebrows as high as you comfortably can. Yes, no, you cannot use your hands. I'm just showing you. Raise them as high as you can and hold them there. Excellent. And relax. Both sides of your forehead moved evenly. So let's repeat that once again. So raise your eyebrows again. Hold. Good. And relax. Perfect. Now, close your eyes gently, not squeezing them, just nice and slowly. Excellent. Open them again. This time, close them a little bit more firmly. Not painfully, but just more aggressively. Just enough that I can see the muscles around your eyelids working. Go ahead. And hold it. Good. And relax. Very good. Both eyes closed with equal strength. Now, give me your natural smile, just like that. Perfect. Just hold that smile for a moment. And relax. Both corners of your mouth, they lifted evenly. Now, give me a larger smile. Everything you've got. Really show you that smile off. Hold it. And relax. Very symmetrical. Now, I'd like for you to take your cheeks. I'd like you to puff out your cheeks and hold the air in them, like this. Go ahead and do that now. Puff your cheeks out. Perfect. And keep holding. Keep holding. And relax. Good. I didn't notice any air escaping from either side of your mouth. So what I'd like you to do now is press your lips tightly together, just like this. Go ahead and relax. Excellent. I'd like for you to now just open your mouth just slightly, like that. A little wider. Good. And close. Perfect. Your jaw movement on all sides appears smooth and centered. So please now stick your tongue straight out for me and just hold it there. Just stick that tongue out. Hold it there. Excellent. And relax. You can put your tongue back in, yes. Your tongue, what I was looking for, it remained center, which is what I wanted to see. Now, finally, I'd like you to clench your teeth. Just like that. Hold. Good, and relax. Very good. The facial movement screening looks normal and balanced. So let your entire face relax again. Let it all go. You can blink naturally. Yes, excellent. Now, we'll finish with a few short attention memory and coordination exercises, all right? So, I'm going to give you 3 words to remember. Don't repeat them yet. Just keep them in mind while we do the next few tasks, all right? Perfect. So the 3 words are going to be garden, coffee, and window. So garden, coffee, and window. Take a moment to picture each one. A garden, a cup of coffee, and a window. Perfect. So we will return to those words shortly. Now, follow these instructions in the order I give them, all right? I'd like for you to blink once. Perfect. I'd like for you to smile. Good. Now, you can relax. Excellent, excellent. This time, blink twice, then raise your eyebrows. Go ahead. Perfect. Now, look at my left hand without moving your head. Excellent. Return to center. Same thing, but now I'd like for you to look at my right hand. Keep your face stationary, just move your eyes. Good. And back to center on me. Now, keep looking at my nose while I move one finger. All right. Follow the finger while looking at my nose. Good. Don't follow it. Just notice it. Excellent. All right. Repeating this one more time. Perfect. Your attention remains steady even when there is movement around the central target. So now I'd like to follow my one fingertip session one more time. All right. I had a tongue twister there. I was thinking about what I had packed for lunch. So keep your head still. Only your eyes should move. I know. Sorry. I got distracted. My stomach has a mind of its own. Just follow across and back. Excellent. Up and down. Perfect. Follow around. Good. Very smooth. The other way. Excellent. And return to center. Go ahead. Blink naturally. Now, what I'd like to quiz you on is I'd like to return to the 3 words I gave you earlier. Take your time. Do you remember what they were? Yes. Yes, if you know what they are, I'd like for you to repeat them back to me. Go ahead with that first one. That's correct. Garden. Coffee. Window. Excellent. You recalled all 3 with what I imagine as no difficulty. And that completes the active testing. So, I'm going to summarize everything we've assessed across both appointments. Yesterday, your eyes appeared healthy on external inspection. Your pupils were equal and they responded appropriately to light. Your eye movements were smooth in every direction we tested, and both eyes worked together during tracking and convergence. I didn't notice any restriction, any significant drifting or unusual delay. And today, your peripheral visual fields appeared balanced. You detected movement consistently from the left, right, above, and below, and your finger counting, color recognition, brightness comparison, and near focus responses were all appropriate. Your facial movements were symmetrical. Your forehead, eyelids, cheeks, lip, jaw, and tongue all moved as expected. Your attention remained steady and you followed multi-step instructions without difficulty. Your short-term recall was intact and your final coordination exercise was smooth and controlled. Taken together, today's findings are reassuring. I didn't observe anything during this screening that would concern me. Of course, this is a relaxation roleplay and not a substitute for an examination by a qualified health professional. If you ever experience sudden vision loss, persistent double vision, severe eye pain, new weaknesses, or significant dizziness, you should seek proper medical assessment. But with today's appointment, everything remained consistent and healthy looking. You did extremely well. Thank you for returning at 9 this morning and allowing us to complete the assessment properly. Before you leave, take one slow breath in and breathe out. Perfect. Blink a few times. Relax your eyes. Let your shoulders drop. Excellent. That completes your follow-up appointment. You don't need to do anything else today. Give your eyes a little rest. Stay hydrated. And take your time getting back into your morning. Thank you again for coming in. Take care of yourself, and we'll see you at your next checkup. I'd like to thank my Patreon members again for their continued support. It truly means the world to me, and I hope that you enjoyed the content that you watched today. Again, if you're looking for other content that I create on other platforms, my links are in the description below.